Hi everyone, this is Dr. Farida Rajan Ibrahim Omasundi, and today I'm going to discuss fibroids. So I'm going to look at the types, the causes, the symptoms, the complications, the prevention and treatment. So if you are new or you're just coming across this channel and you haven't liked, please do like, share and subscribe. So today we are going to discuss fibroids. What are fibroids? So these are also called leiomyomas, and they grow in or on the uterus, and they are non-cancerous tumors. So these growths originate from the smooth muscle layer of the uterus and are made up of muscle and fibrous connective tissue. And while fibroids are not so life-threatening, they can cause significant discomfort and complications in many women. And these can range in size from a tiny seed-like nodule to large masses, and this can distort the shape and size of the uterus. So a woman may have one fibroid or several fibroids at the same time. So what are the types? So depending on where they are located in or around the uterus, we can have these types. The first one is intramural fibroids. So these are found in the muscular wall of the uterus, and they are the most common types. So we can also have the subserosal fibroids. These are the ones that grow on the surface, on the outer surface of the uterus, and they may project outward. We can have the submucosal fibroids. These are the ones that are located just beneath the inner lining of the uterus and can protrude into the uterine cavity, often causing heavy bleeding. We can have the pedunculated fibroids. These are the ones that are attached to the uterus by a stalk. So what causes fibroids? There are various causes of fibroids, such as hormonal influence. So for hormonal influence, this is where we have things such as estrogen and progesterone. Progesterone hormones that regulate the menstrual cycle, promoting fibroid growth. This explains why fibroids often grow during pregnancy when these hormone levels are high, and they shrink during menopause when these hormone levels are low. We can also have genetics as a cause. A family history of fibroids may increase your risk of developing fibroids. Ethnicity is also a cause. Fibroids are more common. They tend to appear earlier and are more often larger in Black women compared to women of other ethnic backgrounds. Age is also another risk, as most fibroids are diagnosed in women aged 30 to 50 years, and they are rare in younger girls before menstruation begins. Obesity and diet also, because higher body fat can lead to increased estrogen production, and then diets that are high in red meat and low in vegetables, fruits can also increase the risk of developing fibroid. So what are the symptoms? So the symptoms can include heavy or prolonged menstrual bleeding, which we call menorrhagia, one of the most common symptoms, and this can interfere with daily activities. It can also lead to iron deficiency anemia, because many women may pass a lot of blood. Can also experience pelvic pain and pressure, because large fibroids can create a feeling of fullness, heaviness or pain in the lower abdomen, sometimes described as constant cramping. So we can also have frequent urination and difficulty emptying the bladder, because most fibroids press against the bladder. It can reduce bladder capacity, causing increased urination and sometimes incomplete emptying. We can also have constipation, because fibroids press on the rectum and can make bowel movements difficult. There can be pain during sexual intercourse, which we call dyspareunia. There can be back or leg pain. We can also have fertility and pregnancy complications with fibroids, because these fibroids can interfere with implantation or block the fallopian tubes, reducing fertility. And during pregnancy, these fibroids can also lead to things such as miscarriage, preterm labor, or abnormal fetal positions. So how are they diagnosed? So these fibroids are often diagnosed with an ultrasound, which is the most common imaging test. You can also do other tests, such as an MRI if you want to be provided with detailed information about the size, the number, and location. You can also do a hysteroscopy. So what are the treatment options for fibroids? So the various treatment options for fibroids include watchful waiting. So you have to monitor fibroids, you monitor the symptoms, and you do regular checkups. You can also give medications such as hormonal therapies, for instance birth control pills, IUDs to help regulate heavy bleeding. But bear in mind that this does not shrink the fibroids. You can also give GnRH agonists that will temporarily shrink fibroids by inducing a menopausal state. You can give tranexamic acid to reduce the menstrual bleeding without affecting hormones. You can also give pain relievers such as NSAIDs to help menstrual cramps and discomfort. Surgeries, they can also be surgical options such as myomectomies, the hysterectomy. And what are the possible complications with fibroids? So you can have severe anemia because, as we discussed, they can cause prolonged heavy bleeding. You can also experience infertility or recurrent miscarriage. There can be chronic pelvic pain. There can be obstruction of the urinary or GI tract, and they can also cause emotional distress such as social withdrawals or depression due to chronic symptoms or infertility. So what are the prevention measures? So you can maintain a healthy weight. You can eat a balanced diet, limit red meat and alcohol. You can also strive to manage stress and avoid exposure to environmental estrogen like compounds. And you should aim to see your gynecologist for early detection. So that was it on fibroids, and I hope to see you in the next video. Thank you.